Well, all the single viewers know getting out and meeting people during COVID-19 has been difficult, so a lot of people have turned to online dating. But what does dating in 2020 look like? We pulled in 2 dating experts to weigh in and provide insight on how to navigate dating during a pandemic.
I think they're realizing that we have to adapt.
Rachel D'Alto is the chief dating expert for Match. She says since the pandemic, they've seen a 40% increase on their dating site. In fact, dating sites across the board have seen a spike in singles looking for love. But the way people are approaching dating in 2020 has changed. Some might argue for the better.
This is the death of the hookup culture because you can't leave your house. But I don't think it's going to die completely. What I think is going to happen is we're going to continue to realize that having those deeper conversations, being a little bit more vulnerable, talking more, you really do realize that there is a benefit to that.
A recent Singles in America study showed 69% of people admitted to having more meaningful and honest interactions. But in an era of social distancing and face masks, what happens when people are ready to take their online connection to the next level?
We're in Vegas. We've got great weather. We've got so many great restaurants, so many venues with outdoor, dining where you can still be safe. You can wear your cute mask.
Andrea McGinty is a local dating coach, and she's seen an increase in clients wanting to get out there and make a love connection.
This time of year, people are thinking of dating and getting back out there.
She says if she can give one bit of advice to all the single viewers, it would be don't let loneliness push you to date just anyone.
Desperation is no reason to date.
Instead, you should take your time and thoroughly vet anyone you meet online through video chat. That's one component that dating experts think will stick around long after the pandemic.
I think people realize you can learn a lot about somebody when you are connected on video, and you don't have to spend an entire evening or go to dinner with someone and then realize that there's no chemistry.
And dating experts also say before you meet someone in person, it's important to have a conversation about what COVID-19 safety precautions you plan to take. In fact, Match now has an option where you can put that information right in your profile. For News 3, I'm Gabby Hart reporting.
Well, Gerard, doctors and nurses across the state of Nevada are having to work around the clock to see that increase of patients when it comes to COVID-19. And today, another troubling trend as we saw another record of hospitalized COVID-19 patients. In fact, taking a look at the data here, over 1,700 people are now hospitalized with COVID-19 in our state. We've also broken a daily record for the most cases, well over 3,000, and our positivity rate spiked to 20%. To put that into perspective, we were nearly half that, around 11%, just 1 month ago. Chris Lake with the Nevada Hospital Association highlighted these concerns at a recent COVID-19 task force meeting. He says Nevada hospitals are feeling the stress but can manage it at this time. But with the disturbing medical data, there's a growing sense of concern. Dr. Deborah Cools is the president of the Clark County Medical Society. She says these trends simply aren't sustainable.
Dr. Cools, what's your concern if this trend continues for the next 2 weeks?
So my concern is that we're going to run out of space, and we're going to run out of healthcare workers.
Now, on a positive note, hospitals are reporting an adequate amount of PPE and ventilators, but Dr. Cool says that you can still do quite a bit to help them out here. Make sure that you continue to wear a mask, social distance, and wash your hands as much as possible as we continue to get through this. Reporting live from the newsroom, Lauren Clark, News 3.
All right, praying we'll see a reverse in that trend. Lauren, thank you so much.
This is a tremendous scientific feat.
2 vaccines made in record-breaking time. As the nation potentially ramps up to deliver and administer them, questions remain. How many doses do I need? When can I get it? And is it safe? Let's start with that first question. Both Pfizer and Moderna vaccines will require 2 doses. The Pfizer vaccine requires 21 days between doses, Moderna 28. And yes, doctors say you must take both, starting with the healthcare workers slated to get their first dose in a matter of weeks, then working down each tier. Vaccines will be administered at local pharmacies or doctor's offices. Local pharmacist Dr. Christina Madison says getting the vaccine is similar to the flu shot, but one change. You will be monitored for up to 30 minutes for any adverse reaction.
The process, will be significantly longer than when you would get it at, say, your traditional pharmacy setting and just go in and go out. This will take a little bit more extra time.
Side effects are possible too, says vaccine researcher Dr. Manis Mandel with Roseman University.
Headache, overall malaise, fatigue, little feverish condition, but it's not significant, and usually they do not last over 24-hour period of time.
Experts predict the vaccines will be widely available spring or summer of 2021. Then finally, we come to the question on so many minds. Is it safe? Both doctors we spoke to today point to the worldwide scrutiny, thorough process, and over 90% efficacy rate to say yes.
We can confidently say these are done with integrity, with the best of our abilities and knowledge.
So let's put this into a little bit of perspective for you guys. A flu shot efficacy rate usually is from 40 to 60%. These two vaccines we're talking about are at 90% efficacy rates. We also asked doctors the question, if you've had COVID-19, are you recommended to get the vaccine? Both of them said yes, because it is possible, according to medical studies, to get COVID-19 twice. Now, we have so much information, we couldn't all pack into that story. We have it, though, on our website. That's news3lv.com, where you can take a look at that, some of yourselves, and answer some of those many pressing questions you might have about the vaccine that we will continue to report here right on News 3. Reporting live here in the newsroom, Lauren Clark, back to you guys.
Many people across the country now flocking to Christmas tree lots as a bright spot during the COVID-19 crisis. Here in our valley, Rudolph's Christmas trees, a staple for decades, is already seeing a 30% increase in sales so far this season. Owner John Rubico says they even opened 3 days earlier this year. A recent survey by the Christmas Tree Promotion Board discovered many people who put up an artificial tree last year plan to buy a real tree this year. Many of them citing the pandemic as the reason.
It's been a tough year for a lot of people, so we just need a little bit of joy in our lives, and I think that we're kind of, wanting that early.
But it does really make it a little bit something to look forward to in kind of a bleak year, so hopefully we'll have even more to look forward to next year.
Rudolph's Christmas Trees also has an online store where you can shop for your tree and have it delivered free of charge. We have more information on our website, news3lv.com. Just click on this story. Meantime, Las Vegas Fire and Rescue has some tips to keep in mind to keep your Christmas tree healthy this year and also to keep your home from going up in flames. Make sure you water your live tree every day. The major reason for fires this time of year is due to dry trees, and it is very dry here in the valley. In some cases, a tree could need 2 gallons of water per day. The fire department recommends watering your tree in the morning and again in the evening. Never let your watering system run dry. Once that happens, the tree tends to form a sap seal at the bottom of the trunk within 10 minutes, which will keep the tree from absorbing any more water. Perform daily freshness tests as well. Gently pull on a branch with a closed hand to see if the needles fall off. And if they do in excess, well, the tree is essentially dead and a hazard and needs to be removed. Also, make sure to keep your tree away from heat sources, smoke, candles, heaters, that sort of thing. And of course, inspect all electric lighting for any frayed or broken wiring before putting them on your tree, and shut your lights off when you go to bed or leave your home.